Anyway, you ready?
I'm ready.
All right, cool. Welcome back to another episode of Halfway Up, and I call it Halfway Up because you never finish rising. And today, I'm in the presence of greatness.
Thank you. Thank you so much.
I'm in the presence of greatness. I'm gonna be honest with you. I feel like there's no reason why a doctor should ever be in my presence outside of me going to the hospital for a checkup. That's how I feel because I don't think regular people, I would consider myself a regular person, right? The average citizen, you know what I mean? I represent the rest of the masses. We do not have relationships with the higher ups of professionalism in that way. I'm not trying to do too much by saying that, but like the truth is like doctors, lawyers, niggas who in the stocks and bonds, investment bankers, whatever, all of these people, they represent like they perform on a higher level of society. They have a higher commitment to servitude to the people. You know what I mean? And they usually niggas don't just be knowing doctors.
Okay. I think I have a different perspective because I am a doctor.
Tell me your perspective.
I think I know quite a few doctors, so it's a little different. I guess my world and my view is a little different because I am a doctor, so I'm surrounded.
You submerged in it.
Yeah.
Fully and completely.
But everybody's amazing. You're an amazing person.
Yeah. You know what? When I say that, I don't say that to like put doctors up on a pedestal or nothing because we're all human. I don't mean to do that. But what I am trying to say is that it is not common to be like sitting across from a doctor and just kicking it and having a normal conversation.
Really?
Yes. Listen, you're very jaded if you don't think so.
I don't know. I don't think so because I know so many doctors and I know so many Black doctors.
Because you're in the medical world though.
Yeah.
You know, like you decided to commit your life and your time to becoming a doctor to help people. So everywhere you go or where you spent a lot of majority of your life is toward like-minded people.
Yeah, that's true.
You know what I mean? Versus like when you're out in, I would say, normal society, you know what I mean? It's just not common that you would find somebody.
It's just so funny.
It's just, you don't like the way it sounds?
Society, it's like,
I'm not trying to say, because I'm not trying to create a separation because I know at the end of the day, we all just people.
Yeah,
I know
absolutely.
That. Yeah.
So no, I definitely don't put myself up on a pedestal. I'm a regular person.
And I don't even mean to do that, you know what I mean?
No, don't.
Okay.
Yeah, you shouldn't.
Okay.
I'm a regular person. I just so happen to be a doctor, right? And that creates like a little bit of pressure too.
Okay.
When people do that, because it's like, well, one thing is like I like having my nails done, right? And
Still
I like designs. Yeah, I like designs. I like my hair done. I like to dress a certain way. And there's a little bit of pressure where it's like, well, should a doctor have their nails done? Should a doctor have color hair? Should a doctor wear, the kind of clothes that I typically like to wear? So there is a bit of a stigma with that when people put us on a different pedestal,
Yeah. I mean, that's a great question. That's a really great question. But I guess the fact that you're a Black doctor, that makes even the more difference. You know what I mean?
Yeah. Because I feel like there can be a little bit of discredit when you do dress kind of like normal.
Outside of like quote unquote professional expectations.
Exactly. Like if I do have designs on my nails or I do have a particular hairstyle or I do want to put color in my hair, then it's like, okay, well, you're already a female.
It's like, I don't
you're
want
already
that
Black.
She got red in her head.
She probably doesn't know what she's doing. She's probably too committed to her looks, right? So there is a bit of that stigma as well when you kind of put that pressure on. I remember one of my cousins saying, oh, I wouldn't go to a doctor if they had their nails done like that. And I was like, but my scores are always scoring. Like I'm always really good with what I do,
But you see what I mean though? Like even people having that perspective of doctors is even more to what I'm saying about like people that are not performing at this level of like professionalism. It's like it's like no reason for us to be near doctors because there is this like perception of how doctors should be, right? It's like they're not at McDonald's with the rest. I'm not at McDonald's either, but it's like they're not at McDonald's with the rest.
Nobody should be at McDonald's.
They should not, you know what I mean? But they're not at McDonald's with the rest of us. They're not like what grocery stores do these niggas even shop at?
Whole Foods.
Most people don't go to Whole Foods.
Really? Where do you go?
Most people, I will go to Whole Foods. I'm gonna pick Trader Joe's first personally because the pricing is just way better. And if there's something at Trader Joe's that I can't get, then I'm gonna go to Whole Foods. You know what I mean? But even in that way, when it comes, I'm like very committed to my health though. And I can tell you as a person that is a part of a huge community, like I have so many friends and so many people that I speak to on a monthly basis that almost nobody lives the way that I live though.
As far as healthy
goes, you know what I mean? So there's just things that separate you. But listen, before we get any further into this, though,
Okay.
thank you for being on the show.
Thank you for having me.
I'm honored. I
Yes.
truly appreciate it. And we said a little bit, but before we go any further, if you could please just introduce yourself to the people. Tell them what
Okay.
your name is. Tell them what you do.
So my name is Dr. Jennifer Charles. I am a
Mhm.
board-certified anesthesiologist. I've been practicing for about 7 years, and I'm also a mother to an amazing little girl. I specialize in acute pain management and regional anesthesia.
That's
That's
fine.
it.
That's beautiful. You a
Thank you.
professional.
Well,
You don't
stop
like-
it.
you
But
don't
you're a
like-
professional too. What you do is great. I couldn't do what you do. I couldn't do what you do.
You could.
Every
I could teach
is
you.
it- okay.
I got a better chance of teaching you what I do than you teaching
Being an
me
anesthesiologist?
Yeah, like
being-
what
it's-
is going on?
it's a lot.
And an anesthesiologist is what specifically?
So basically, we're responsible for making sure that your vitals are normal during surgery. We're the people that put you to sleep. We're the people that help you with your pain management postoperatively and intraoperatively. Yeah, that's what an anesthesiologist does.
That's amazing.
Thank you.
And how long did you go to school to become
Oh
an
my God.
anesthesiologist?
That was it. It was a process. So when I did it, there's ways to shorten the length to becoming an anesthesiologist. But when I did it, it was 4 years of college, 4 years of medical school, then 4 years of anesthesia training.
Jesus
With 1
Christ.
year being your intern year, where you can do internal medicine for a year, or you can do something where you can do a little bit of everything. You can do surgery, and that's it. And then 3 years are dedicated to anesthesia, to the
Wow.
practice of understanding anesthesia, the physiological and pharmacology behind anesthesia.
So you were in school for like 12 years?
12 years, correct.
Jesus Christ.
It's a process.
Nah, listen, I tip my hat off to you because listen, that takes a level of commitment that will always separate you from the general masses. And I want to be able to say that without it feeling cringy or like, I'm not putting you on a pedestal, but like facts are facts.
Mhm.
That's amazing. That level of commitment and dedication, most people, I don't think maybe I'll say this, I don't think most people have found something they're willing to be that committed to and for.
Okay.
In the 8 years that you've been practicing, right?
Yes.
I want to ask you a question. I want to get your opinion on this
Okay.
question. All right, cool. In the 8 years that you've been practicing, do you think that there's a difference between healing a patient and giving a patient treatment?
Oh, okay. This is a very loaded question.
Is
So
it?
I think so. Healing
Hmm.
and treating,
Mhm.
right? Healing and treating.
And that's just based
So-
on what you've seen, what you've noticed, seen other doctors do.
I think allopathic medicine in general is more focused on
Allopathic
treating.
is what specifically?
allopathic is what I am. I
Okay.
do allopathic medicine. I'm a
Mhm.
medical doctor, MD. I'm not an osteopathic physician, which is a DO. There's a
Mhm.
difference. I feel like there's so like medicine is so vast and so broad,
Mhm.
right? It depends on where you're practicing.
Mhm.
I'm an anesthesiologist, so I'm going to be in surgeries.
Mhm.
So we're going to be treating you for a
Right.
problem,
Mhm.
right? So I specifically specialize in orthopedic surgery. So if you have knee pain, shoulder pain, you're going to get a replacement. We're treating the problem. You're going to get a replacement.
Mhm.
Okay. So I'm not a part of. Is that healing too, though? If you're getting a
You know what?
replacement?
As I'm listening to you explain it, I think it's such a fine line between treatment and healing. Even as I asked the question, because I'm not, a specialist, I'm not even really sure what I mean by the question. I just thought it was a good question. But
Let's talk about healing, though.
Let's
in a
talk
way
about
that I think that you're kind of trying to ask me.
okay.
So one thing is a disease that's really prevalent in the African American community or Black community is diabetes,
Mhm.
right? So treating or healing, right?
Mhm.
I see a lot of rhetoric amongst our community about doctors not being healers. All we do
Mhm.
is treat. We give patients medications.
Right,
It's
medicate.
like,
Take 2 of
here's
these, call
this
me in the morning.
medication, and you're gonna have diabetes for the rest of your life. I think
Jesus
there's
Christ.
no, but you don't. You don't have to have diabetes for the rest of your life, depending on the type of diabetes that you have.
Right.
Because we know that diabetes is a food-induced disease.
Yes.
Okay?
Right.
So I saw something recently with somebody saying something like, yeah, doctors don't necessarily heal. It's just giving you medications and that's it.
Mhm.
And I disagree. I think if you have a good physician, they know the literature and they know what works and they know what the source of the problem is.
Mm-hmm.
I've been doing this for a long time. Whenever somebody gets diagnosed with hypertension or diabetes,
Mm-hmm.
one of the first things that we recommend is you to go see a nutritionist, because
Mm-hmm.
doctors aren't necessarily nutritionists.
Mm-hmm.
We can refer you to a nutritionist, right? And it's on you to do the work to change your diet and
Mhm.
also exercise. Doctors are not trainers. We're not personal trainers, right? We're going to tell you that you need to, lose weight and eat healthy in order to help your body heal from the disease of food, which is
Mhm.
what I feel like hypertension and both diabetes is, right? So I don't know. We
No,
do treatment
Yes.
and we can also be healers, but I think people want physicians to be a one-all, end-all, be-all.
I think that's what we think it is in
Yeah.
our ignorance, our lack of, because we don't know, right? When we think doctor, we just think fix me.
Yeah.
That's it. We
And
don't.
a lot of the work comes on the patient. Like I said, one of the first things that I tell patients all the time is like, you can get off of these diabetes medications if you exercise and diet. But it's interesting, right? Because medicine is a business.
Yes, it is.
The pharmaceutical companies make a lot of money off
Mhm.
of medications. I think this is what
Mhm.
you're trying to get at. And I'm like,
Well, this
I'm
leads to
bringing
my
you-
next question.
bringing it out of you, even though I don't want to. This is the reality. Big pharma makes a lot of money by keeping you on medications. But
Indeed.
as adults, especially in the African American community, like,
Mhm.
there is some accountability on you as a patient, right? To figure out how to eat healthy.
Yes.
Like the evidence is out there, the literature is out there. We all know that going to McDonald's and Dunkin' Donuts and Starbucks
Slowly
is bad
just-
for you.
Yeah.
I think everybody knows that. There's
Yeah.
nobody who doesn't know that.
Right.
Right? But then
Just
I
completely
think,
surprised. Like, I had no idea.
yeah, right? Like I didn't know that, and I think people also say things like, oh, doctors don't know anything about nutrition. I think we know some things about nutrition. We know
But there's a separation.
yeah, there's a big separation between a physician and a nutritionist.
But
right?
let me ask you though, wouldn't it make sense for a doctor to have, if maybe not be an expert as a nutritionist, but have like a more than enough knowledge in that space because
Yeah.
because it's so contextual to what they're dealing with all the time.
I think it requires more work though, and I don't think
Niggas is going to school for like
lot.
20 years.
But
though.
it requires more work in terms of how patients and doctors interact,
Mhm.
right? So I think it's obvious that we know that physicians make money with how many patients they see.
Mhm.
So the way physicians are reimbursed is with volume. So what I'm trying to lead into is that there may not be enough time to spend with your patient to educate them on how to eat healthy, what to eat all the time. So that's how come we're going to outsource. A lot of things in life are outsourced.
Yeah.
You're just going to refer them to go to a nutritionist, and I don't see anything wrong with that.
Oh my
Or you can
God.
refer them to go see a personal trainer, and there's nothing wrong with that,
Yeah.
right? Or a physical therapist, because a physician can't heal all those aspects,
Mhm.
right? And when those things aren't working, you will be stuck on medication.
Listen, I gotta stop
I
you.
don't know
'cause
if I'm
you-
saying
no,
it all
you
right.
saying too much. You
Okay.
you like literally like ripping my outline to shreds in a great
No,
way.
I'm not.
No, in a great way. Okay, so listen. I have a quote that I want to share from a doctor that I listen to on YouTube all the time. His name
Who?
is Dr. Bobby Price. You familiar with him?
Oh yeah, yeah.
Love this dude, right?
He is a I think
Cardiologist.
he's a pharmacist.
Okay.
I think he's a pharmacist that has like his natural foods
Yes.
that he grows, which I think
Yeah.
is amazing.
No, I think he's a cardiologist though. I could be
I
wrong.
think he's a pharmacist.
I believe you over my perspective over
think he's
this
a
for sure.
pharmacist.
But listen, I want to quote him. I have a quote from Dr. Bobby Price, and his quote is, "You either pay the farmer or pay big pharma."
Pay the farmer.
Yeah.
I love it.
Yeah.
I believe that.
Yeah.
I believe that wholeheartedly.
Yeah.
Because like I said, I think people just don't understand what food does to their body.
Mhm.
We're on, like, the American diet is one of the worst diets. We are consumers of a lot of processed foods,
Meat is banned
a
in
lot
like
of
30 countries, they say.
carbohydrates. I mean, another thing, people say, oh, doctors don't know anything about medicine. One of the first things that I learned in medical school was that eating red processed meats is the fastest way to get colon cancer.
Wow.
Everybody that graduates medical
I
school
mean,
knows
most black
that.
people know that by now too.
That's what I'm saying.
By
But
now, for
you're
sure.
choosing, a lot of people still choose to eat unhealthy because it's very difficult to eat healthy. Like, I have a 6-year-old.
Mhm.
It's hard. Like, making her eat blueberries and strawberries and apples. she wants French toast.
Right.
She wants processed foods. It is very difficult because she goes to school. So she's
Right.
seeing other kids eat
Yes.
these foods. So she's going to request it from me. And even though, I try to limit that,
Right.
it's difficult, even for myself.
Right.
Right?
Right.
Like diet and exercise for myself is difficult. Me
Yes.
going to the gym like
Yes.
3 times a week, knowing that exercise, right, heals you as well is very difficult. So yeah, you either pay the price by eating healthy or you pay the price by paying pharmaceutical companies to manage, right? Because they're not going to cure. These medications that you're on, metformin, insulin, etc., they're never going to heal you. They're just going to mask your symptoms and, probably help with your longevity, but they're never going to heal you. The way to heal is really taking your health serious on your own, because a lot of doctors, yeah, you're right. A lot of doctors really are not going to prescribe you the foods to eat. You're going to have to learn how to do that on your own
Right.
sometimes.
And if I can, to just elaborate on that even further, as I listened to a lot of content trying to get in the right mindset for this podcast that we having, because
Really?
I just wanted to know how to speak to a doctor, because it's just I just wanted to.
First of all,
Go
I've
ahead,
known
go
you
ahead.
for a year.
Go off,
Stop
go
it.
off. No.
I've known you for a year now.
But you know
Stop.
what though? The thing is like I wanted this to be, in a lot of ways, this is gonna be like a regular conversation amongst just two human beings, but at the
'Cause
same,
we are.
because we are. I understand it. Trust me, I'm never gonna get away from that, because I get that. But at the same time, I want to understand that I'm speaking to a human being that has committed their life to a professionalism of serving people, and I want to know how to speak to you the right way to get the most value out of you. But to
Okay.
be honest, though, you kind of just giving everything up
Okay.
immediately. But to my question of like, was there my first question of, is there a difference between treatment and healing? As I was watching a lot of videos, right, I came across two how do you say, like two stories from two different people that was
Okay.
had an issue in the hospital, right? One of them is a famous person named Big Sean, and this other lady, not so famous. Big Sean was explaining he had some issue with his heart, right?
Okay.
And he went to the doctor, and the doctor was pretty much letting him know, like, we got two different options. Like, we could either do some type of surgery where we're gonna like scar your heart, something like that.
I think I saw this.
Right. I think it was a viral clip.
Okay.
Put
And
like
then he was prescribed magnesium.
Yes.
So here's the thing. I'm thinking, I don't know his medical chart,
Right,
but I'm
neither
thinking
do
he
I.
had something called Torsades de Pointes,
Okay.
which is an electrical abnormality that is treated with magnesium. So I think he went to two different doctors. The first
Right,
doctor,
yes, he did.
and that's the thing,
Look
right?
at you.
Right. I think it's so important for people to understand that when you're navigating the healthcare space, if you don't like what one person is saying, it's okay to get a second
You
or
just
third
destroyed my
opinion.
whole outline, I swear.
Well,
in the
I'm
best way.
sorry.
Like, you're just so good at this right now that you literally, but please go ahead.
I think it's okay to get a second or third opinion. If you don't think the way that the first doctor wants to treat you is something that you want to do, I think it's okay to do your research. I think it's okay to get somebody else's opinion. I think it's okay to find somebody who looks like you, who aligns with how you want to be treated. And I think that we kind of pigeonhole ourselves into sticking to the first person that we met or we
Yes,
know,
yes.
and thinking that the way this clinician practices is the way everybody practices. And that's a fallacy. Do you understand what I'm saying?
100%.
I think you just need to find who works for you. Okay.
That's the thing about, like, when you go to the hospital, or whenever you go to anybody who specializes in something, sometimes as human beings, we forfeit our freedom of thinking and our power to navigate other options because we feel like you're the professional. We put all the power in their hands.
So everybody must practice like this.
Right.
That's not true.
Right.
Everybody does. I see it even in anesthesia. We could be doing the same case. I will probably use different drugs than somebody else is going to use. Yeah, so it's just find somebody who aligns with how you want to be treated, and how if you feel comfortable with them, right? Because I think your intuition knows a lot. You have to trust your gut when you're navigating healthcare.
But
Trust your gut.
Real quick. Oh, I'm so glad you said that. But this is the question though. Like,
Okay.
when you're in these very cold rooms with these doctors, first of all, I don't know why the fuck it's so cold. You know what I mean? I hate being there because I just don't like being cold. But like
in the ER?
it's anywhere in that bitch.
Okay.
It's just cold. You know what I mean? I'm like, it's cold. It's the smell. I don't even know how to describe it. But like when you're there, this level of like, and I'm already thinking about the answer. But anyway, this level of warmth and this level of like familiarity that I'm getting from you as I'm sitting across from you right now, like this is not what you usually get when you in these spaces with these people. But that could probably be largely due in part because those people don't look like me as well, though. And I
That could
find,
be a part.
yeah, and I find that as many times. So the only thing that I've went to the hospital the most for in the last like 5 years is for just having anxiety. There was a couple times where the anxiety got to such a place where I was just like, I just want to be sure that this is not something
Like
else.
a heart attack.
Yeah, you know what I
Mhm.
mean? Or just anything, you know what I mean? Like,
Mhm.
let me know. And when I go, I've never, maybe a nurse, you know what I mean? Maybe somebody that I see before I get to the doctor, but like never the actual doctor do I get to them. And then this warmth, this level of familiarity that I'm feeling sitting across from you, I don't feel that. I
Mhm.
don't feel that. And what I do feel is a very lack of enthusiasm. You know what I mean? I feel a lack of I feel like I'm dealing with burnt out people. You know what I mean? Like they tired.
Burnt out. Okay.
Burnt out. They tired. You know what I
Yeah.
mean? Like when I see them, I think they already lost the better half of the energy that they had to give forth. And now it's just kind of like let me just go through the motions of the training, like 1, 2, 3, step to 10. Okay, see you later. You know what I mean?
So again, you're saying a lot of things.
Yes, I
I'm
am.
trying to figure out how to
Yeah.
address it in a systematic
No, take
way.
your time.
So one thing is, and I hate to say it, but we know that there's literature that shows that patients who are taken care of by people who look like them tend to do better,
Mhm.
right? And there's a big push for
I know that's true.
more diversity. I mean, there's tons of literature.
I feel better as soon as I see a black person.
You feel better.
Absolutely. Immediately.
So the reality is that there is supporting evidence in literature because we love evidence-based medicine that shows that when Black patients are taken care of by Black doctors, not saying that this is completely exclusive to this fact, but they tend to do better. There was a study that I saw not too long ago that came out of Florida and said that premature babies had a 3 times more chance of surviving when being taken care of by a Black neonatologist. That means that if they were taken care of by a doctor that did not look like them, they had a 3 times more chance of dying. Okay? This is literature. So yeah, there is a big push for institutions that get it, because not all institutions are going to get it.
Mhm.
And I know people are going to be watching this and they're going to hate me and they're going to say
No,
there's no
nobody's
such
gonna
thing.
hate you.
Oh, yes, they are. They're
Oh,
going to
maybe the
say,
haters, you know what I mean?
they're going to say there's no such thing as racism in medicine. And it's 2024. And we know for a fact that there's racism in medicine.
Mm.
I know for a fact that there's racism in medicine.
Mm.
There are racist people who practice medicine, just like there are racist police
That's
officers,
terrifying.
right? To think that
That's terrifying.
medicine is exclusive to racism is crazy to me.
Right.
Right? And the fact that
Like the hospital is just the equalizer where all
yeah,
people
and
meet.
it's not.
It's not.
It's not. And I hate to say that. I know people, and I know people who are not Black, right? That are excellent clinicians.
Absolutely.
Right? I'm not saying
Love is
that.
love.
Yeah. I'm not saying that other people cannot take care of Black
Absolutely,
people.
of course.
I'm just saying what the literature shows.
Of course.
And I want to talk about this one case.
Talk to me. Let's do it.
Which is not a nice, it's not nice. Because I remember somebody, like, so during COVID, we know that a lot of African American people died at a faster rate and had a higher death rate than others,
Mhm.
right? And this is a multifactorial reason. I feel like we're going off topic real quick.
No, not at all.
Multifactorial because one, health, right? Black
Right.
people sometimes
Where the health was prior to
correct.
receiving
We
it.
tend to suffer more with diabetes, hypertension,
Mhm.
that tends to be resistant. Obesity, I don't know if I can use that word anymore. I think
Why not?
overweight, because there's some controversy with using that word.
Okay.
And also what people tend to not look at is redlining. Communities that were once in red line zones
Mhm.
still inhabit a majority of Black people.
Could you? I know what redlining means, but could you explain a little bit when
Oh,
you
okay.
use that? What
So
do you mean?
redlining is when I think the government did not provide mortgages to Black people
Mhm.
because they were in a particular zone. And I'm pretty
Mhm.
sure some financial
Things
person
that
is
they
going to
could technically qualify for.
correct
Loans. They
for
couldn't get
mortgages
these
specifically
things.
for
Yes.
housing.
Mhm.
So within these communities, you have to assess the hospitals. They're
Mm.
community hospitals and they're not good hospitals. So when you look at the big picture of COVID, the Black people were dying in hospital systems that were already struggling in a lot of red-lined communities.
Mm.
Okay, so we have health being an issue, then we have the hospital being an issue. Okay. But what if you so happen to be in a good hospital? And I'm going to give you a story about
Right.
one of my girlfriends that worked in a hospital in the city. I
In a
will
good
never say her
hospital.
name. It's a decent hospital.
Okay.
And she told me that she had a Black patient, right? That coded, which means her heart stopped. And they were running a code, which means that they were providing her with chest compression and oxygenation. And they were running the code for a minute. I think it was like maybe 4 minutes. But she knew, and everybody on the team knew, that she coded because I think she had a mucus plug. So if you bag the patient enough, you can dislodge the mucus plug and have your cardiovascular system working the way that it's supposed to. Everybody else on the team was not Black. She was the only Black doctor on that team. They wanted to stop the code. She did not want to stop the code. Other doctors left. She stayed. She ran the code, and the patient came back. That's a small example.
That's so big, though. That's huge, though. So there was an extra mile
that she
the
went.
difference would have been made, and a nice majority of the doctors decided to not take that extra mile.
Exactly. So that's the scary thing. I think I interviewed.
It
It is scary because you don't know. You don't know who you're going to meet when you go into the hospital. There's another case that I saw.
And you scared.
Oh my God, I forgot her name, but it's on YouTube. I'm gonna see if I can find you the name. It was an African American woman who went to the ER, and she was complaining of having chest pain. She was having difficulty breathing. I didn't see one Black doctor, one Black nurse there, and they kicked her out. They discharged her from the hospital, and she died in the parking lot. They arrested her and removed her from the hospital, arrested her, removed her from the hospital, and she collapsed outside. Brought her back, and she had a pulmonary embolism.
And what is that?
Okay, so it's a blood clot. So a pulmonary embolism is when you have a blood clot that moves from an extremity, typically it's the lower legs, that goes to your lungs, and you need your lungs for oxygenation. So she had a PE. She died from a PE. Which, if they caught, they could have gave her blood thinners. They could have saved her. So you see a lot of examples of Black people who are dying in healthcare. We can go down. We could talk about so much. We can talk about how medicine was built on Black people. There's so much we can talk about. Listen, I feel like we should stay focused on one thing.
I gotta have you come back because we are running out of time. It's 1:14 right now.
It's okay. We have time to talk.
Okay, so is it possible for a doctor to be indoctrinated?
Yes.
And that's why I say, like, you killing my outline, because you literally are like, you giving me everything that, like, before I even get down to it, it's like you said so much already.
I know, because, I think these are things that I think about.
You think about this a lot.
I think about it all the time.
It's on top of mind for you.
All the time. Because you see it in healthcare, you look at it, you're like, well, how can people want to get rid of DEI? There was a big push for, right? I think for college universities as well, not only in medical. So it's diversity, equity, and inclusion.
Okay.
And there's a big push to get rid of diversity, equity, inclusion in medical schools because they believe like it's a form of reverse racism. I know, it's crazy.
I'm like, how does
it's crazy?
What?
The
enemy be working
double time, overtime.
For real.
So that's how come I started my podcast, right? Was to show people how you can have people who are really relatable, who are really warm, who really care, who are passionate about what they do in medicine, and really to destigmatize some of the things that I hear on the internet. But to go back to what you were saying, you said so much. So, so we talked about racism a little bit, that there could be people who just don't care about Black bodies in medicine. And we know that this has to be true because medicine was kind of founded on this in the U.S., right? We can talk about Marion Sims, who's quote unquote the godfather or the father of OBGYN, who practiced surgery on Black slaves without any anesthesia, even though anesthesia was available.
That is insane. We could just take a quick moment to just think about a person cutting into flesh and doing things to a vulnerable human body without protection. You know what I mean? So they just feeling everything.
I think to this day, it's interesting, right? There are people who still believe that Black people don't feel that much pain.
People that are medical professionals?
Yes. Yes. You could look this up. There's literature to show that there are people who are going through school who believe Black people do not feel as much pain as their counterparts.
I need some of these licenses to be revoked. What did we call it? Is that what it's called? Professional license or something? I need some people. You know what? Doctors need to be like, is it
But
called
nobody's going to say that they're racist. Nobody's going to, right? Nobody's going to say that. And I think,
we
and
need
I
a
could talk about so
psychologist to
much.
talk to them then or something.
How are you going to know?
Like that's what I mean. Like we need like a psychologist to audit doctors and like so maybe like a doctor needs to see a psychologist mandatory every once a month or something.
Do you think a psychologist is going to figure out if somebody's racist? No, they're smart. They're highly intelligent.
I think a person with deep intuition will find one breadcrumb that'll lead them to something.
I don't necessarily.
I would like to think that.
I think the way, because one of the biggest issues that we're facing with now is African American women dying 3 to 5 times more than their white counterparts during
3 to 4
times during delivery, during their pregnancy experience. And a lot of this is happening during pregnancy and after delivery, right? Because institutions still aren't listening to Black women. I think that's one of the biggest issues.
They're telling them what's going on. They're telling them how
that
I feel.
They're okay.
They're okay.
Right? They're not listening to complaints of having chest pain, having difficulty breathing. And there's a documentary now. I'm not sure on what platform it's on. It's called Aftershock. You got to watch it.
I'm going to watch it.
You got to watch Aftershock because they really go into it. So there's a big mistrust, right?
Right.
And sometimes you have to understand why there's a mistrust that Black women have with the medical community. But we're talking about so much.
Yeah.
So burnt out. Go ahead. What did you want to say?
The thing, and that's, again, it's scary because there's only one place we feel like we can go to, right? Like we go to the hospital because we're asking for help. By the time you go to the hospital,
you're vulnerable.
You are at your most vulnerable state. You've hit rock bottom. You tried everything else. You know what I mean? You've confided in the people to, maybe it's in my head, I want to be calm or whatever. And then you go there and it's like, okay, now I need y'all to help me because there's nobody else that can help me. And then the fact that there's a potentiality that I may deal with the person. And I want to be careful about that because I want to
because it's not everybody.
Yes. And I want to give all respect to every single professional in that building that has a heart for loving and making sure people feel comfortable.
And there's a lot of them.
There's a lot of them. So many of them. I know that to be true because I think one problem that Americans have is that we overgeneralize from a negative perspective. And that's such a bad way of seeing things because you just walking down, you're losing in life already by seeing the worst in people versus taking a moment to just realize there's so many beautiful people that look nothing like you, speak different languages, but they're here to help though. Yeah. But it's really scary when you go to that hospital and you're telling them what's wrong with you in the sense of a lady is giving birth and then the doctor is telling you, well, based off the EKG, based off of the blood, it's like everything is fine. And not to compare my situation to a woman giving birth, but I feel a very similar way when I go to the hospital for anxiety and they just looking at it like, you good, my nigga, just take 2 of these, call me in the morning, take this Valium, you know what I mean? Or whatever little medication. And they send you home. And it's like, bruh, I know, I get what you're saying.
I want to get to that too.
Let's get to that. I want
to talk about anxiety. I want to talk a little bit about depression, right? In two fashions, in two forms. So going to the ER, unfortunately, the ER doctor is not going to treat your anxiety. Okay. That's number one. I think it's so important as a man or as a Black man for you to form a relationship
with a doctor,
with a therapist,
with a therapist.
Right? With a therapist, and that can help you, right? There's behavioral therapy that can help you deal with these whatever symptoms that you're feeling.
Yeah, for sure.
There are people who are I'm in therapy, right? My therapist has taught me box breathing. Has taught me different ways. You know what box breathing is. That are going to teach you non-pharmacological approaches to deal with what you're dealing with. But it's so important to know if you are struggling with something, with anxiety or depression, to find somebody to help you.
Yes.
Right? And find a good person to help you. Because like I said, not all clinicians are the same. Not all clinicians are going to show you non-pharmacological approaches to deal with some of the things that you're suffering with. But if you ever reach a point where you need pharmacological intervention, a lot of people think it's like lifelong, and it's not. Sometimes it could be for a 6-month period, right? And then there's other things that you can do that are non-pharmacological besides breathing exercises. There are journaling. There's a lot. There's
Meditation.
meditation, eating
Sound
healthy,
therapy. You know what I
exercise,
mean? So many different
sleeping,
options.
right? Yeah,
Sleeping.
sleeping, which is
Jesus.
really, really, really underrated. But I think, like I said,
And that's sad.
aligning yourself with somebody to treat you and help you, because the ER, they're not going to treat you there. It is for emergencies. Somebody
Yes.
who, like, they need to triage what real emergencies. Not saying that having anxiety is not a real
Nah.
emergency, but they're more trained in treating the problem. So
Yeah, serious shit, obvious shit.
Yeah, that's what I'm saying.
Like
So
if
that's
you got
one.
blood leaking out of your neck type shit, that's what
Exactly.
we're here to
They
stop.
need to coordinate so they can get you to surgery.
Right.
Because a lot of times if you're going to the ER for things that are not non-emergencies, they're going to tell you need to
Non-life-threatening.
follow up with
Yes.
whatever. Like, for example, if you're having a heart problem or your hypertension is really high,
Mhm.
they can get your blood pressure underneath control and tell you to
Right.
follow up with your primary care doctor. That's what they're doing. They're triaging.
Mhm.
The second thing that I want to talk about is physicians are humans, right?
Yes,
There
they
are
are.
physicians who are going to be burnt out,
Yes.
right? I'm a human being. Life be lifing
Yes.
sometimes.
Yes.
I know how to compartmentalize my emotions when
Mhm.
I'm at work so that
Mhm.
whatever I'm dealing with doesn't translate to how I'm treating my patients,
Yes.
right? But that's me.
That's you.
Everybody can't do that.
I wish they would though.
Everybody. And then not only do you encounter physicians who don't necessarily know how to interact with their patients, but you got physicians who don't know how to interact with staff, that don't know how to interact with nurses, that don't know how to interact with other
But
physicians.
these niggas be geniuses or some shit like that, right?
And they can be,
Mhm.
right? I think I had a question the other day was like, would you rather a mean surgeon
Right.
take care? I think it was you,
Yeah,
right?
yeah,
We were
yeah,
talking
yeah.
about that.
Uh-huh,
Do
uh-huh.
you rather have a mean surgeon who is excellent at what they do, but clearly has a personality issue, take care of you and they're like number one in their field, or have an average surgeon take care of you and was super, super personable?
Listen, man.
What are you going to take?
I
The
might-
average?
I might.
No. Not on my body. No, sweetie. I don't care about your attitude. I want you to do my surgery and do the
So-
best that you can.
So the thing is, the reason why I say that, right? And you know, of course, I would love to have the most prepared and skilled, most experienced person. But I say this from like a damn, I don't know how to articulate this the right way and it sound intelligent, but I'm gonna just say it though.
Go ahead,
You
just
know what I
say
mean?
it.
I'm gonna just say
We're
it.
having
like,
a conversation.
I'm going with the person that makes me feel the most spiritually safe, though. You know what I mean? And depending on your situation, right?
I think it really, it depends on what you're talking about. If we're talking
Depends on
about,
what you're talking about.
a therapist,
Right.
right?
Mhm.
Having a therapist that you can connect with.
Like I don't need the best therapist in the world.
I think,
I need the person who has a heart
yeah,
for help.
yeah.
And that's the problem that I have with all professionals in every space. The police
Exactly.
officers, the teachers, the everything. You know what I mean? It's like these are people you are committed to servitude. And that doesn't mean that you got to be perfect all the time. And it doesn't mean that you don't get a chance just to let your hair down and be like, my nigga, I'm burnt out because
Yeah.
this job is overwhelmingly demanding for one human being ever.
It is.
You know what I mean?
And like I said, life be lifing for people sometimes. You know, sometimes you can tell when certain people are really going through a tough time in their life because
Right.
they're lashing out on their colleagues. They could be going through a divorce.
Wow.
You could have, like, I was practicing medicine. I was sick, right? I had my daughter in the NICU. So you sometimes, but like I said, I know how to like compartmentalize my
Mhm.
emotions and understand that when a patient is coming to me, that it's my duty and my responsibility to
Duty
take
is
good
is
care
the word.
of that patient, right? It's
Mhm.
my duty.
Mhm.
And I take that responsibility.
Regardless about how I feel.
Exactly.
This is what
I
I've
don't care
devoted my
what's
life
going on
to.
at home. I'm a, scream in
For
the
right
hallway
now.
real quick
Yeah.
and then get back to work, right? Or I'm a vent real quick in
Yeah.
between my cases.
Right.
But when I'm taking care of my patient, I'm really devoting my time to taking care of my patient,
Mhm.
right? But not everybody's going to do that. And
wish
you
they
kind of have
would.
to understand that. And that's how come it's so important to find people
Yeah, find your people.
that find your people.
Mhm.
Find the people that, like, I have people all the time who like hit me up like, oh, can you refer me to an OBGYN that you like, preferably Black?
Yeah.
Can you refer me to a dermatologist, preferably? People have their preferences and that's okay. But it's important to know that sometimes clinicians are burnt out and they are overwhelmed because of the structure of medicine, which is payment. Right. And I know people don't like to talk about business. This is still a
Telling you,
business.
here you go,
Sometimes
running through
you
my
gotta
outline
see
again.
you gotta see 50 patients in order to make your ends meet.
So that's how it works.
Yeah. The more like
Why the fuck does it work like that?
What do you mean? It's business.
I want no. But this is the thing. Like, so my doctor is incentivized based on how many people he works with.
How many surgeons?
He don't just get a flat rate.
Sometimes you get a flat rate, right? Because I'm going to talk about the surgical perspective.
Okay.
You can get a flat rate if you're working in the academics, but there's certain criteria that you need to meet. There's a certain number of surgeries that you need to meet. And when you do more,
to get a certain
you're more
amount of bread.
incentivized. You get more money. You get more bonuses, right?
And that's,
it's incentivized.
But isn't that...
Ooh, that's scary. I'm sorry.
Right. When you say it out loud, right? But is that not part of the thing that's leading to the burnout in the first place?
For certain specialties, I would say yes.
For certain, and it's nuanced for different. Okay, right. That's important to speak on. Because my thing is like, I want my teachers, I want my doctors, I want my preacher, I want all of them to be extremely paid.
Yeah, but that's not reality.
It needs to be.
But it's not.
Listen.
So that's how come it's so important. Like, what you're talking about.
Who's running this shit? Fire them niggas. Whoever's like making these rules,
it's a fallacy.
They need to be updated.
There are really good people who practice medicine. Mm-hmm. They don't have to be Black, right?
Mm-hmm. They do not have to be Black.
They do not have to be Black.
Not at all. As long as you got love in your heart.
My uncle's oncologist is amazing. Mm-hmm. He's not Black. Mm-hmm. And he is, like, the first day we met each other, he gave me his cell phone number and told me to reach out if I ever had any problems. They are really, really, really good people who are practicing medicine on a micro level.
Absolutely.
Now, when we're talking about a macro level, this is where you're having issues, right? There's a reason why Black women are dying at a disproportionate rate. There's a reason why African Americans are dying the most from heart disease. There are other things at play, right? And when you're talking about that, it's kind of hard to have just one solution for that.
That's true. I understand that too. What does it take for me to buy a hospital? I'm so serious. I'm so serious right now about that.
A lot of money.
How much?
A lot of, I don't know.
Is it like a trillion? Is it like a billion?
Oh my God. I was looking at the numbers recently. Obviously, healthcare is a multi-billion-dollar industry, right? I want to say it's close to $1 trillion. I think it's surpassing the GDP.
Is it possible for me to... and I don't even know the right verbiage, but is it possible for me to establish a place that does almost completely free work on people?
Yeah, but who's going to fund it?
What do I like in my mind? Like, bro,
I'm talking about universal health care.
I'm talking about like, is there a way where a lady or a man comes in, they be like, I need some shit that usually costs like insane amount of money. I need it to be done. I don't got it, right? I don't got healthcare and I don't got the money. I'm like, listen, I have a place where you can come and you can get it done. It's going to be less than a fraction of the price because maybe this might be super unrealistic, but that's why I'm pontificating about it. And like, I already paid the doctor a certain set of money. He's good. Like, she's good. I gave him $500,000.
So I don't know if there are clinics that do see patients that don't have insurance.
But they do heavy work though?
They do a lot. They get them plugged into the system. And these are typically you can get surgery done for people do perform surgery that you don't have to pay for.
Okay.
There are different channels in America that allow that. Oh my goodness. I think it's called, is it Charity Care? There are different systems at play in order for patients to get healthcare services done. Even with dentistry, whenever you're aligned with typically I see this done at academic institutions. Okay. They typically have clinics that are free clinics.
That's so true.
For dental work.
That's so true.
For medical care.
Yes.
The thing though that people need to understand is that it's typically run by medical students and overseen by attendings,
This is so true.
Yeah.
Yeah, I'm sorry. I'm just like, because I've experienced this before.
Okay.
Yeah.
So it's overseen by attendings, run by residents or medical students. And I think people get really, really apprehensive about this because they feel as though their care won't be they don't think they're going to get adequate care.
Yeah.
But you have to remember, they are being seen by attendings. And at this point in the game, I feel like medical students, they're so passionate. They haven't really got burnt out or really jaded. Yet. They're not jaded by the medical system. So my experience is that for me as a medical school student, when I was taking care of patients, like I just loved what I was doing at the time.
Absolutely.
So I'm always going to provide the best care. Am I jaded now? I'm not going to say that I'm jaded, like have a little bit of distaste for medicine. I'm not going to say that I'm jaded. I do think that we work a lot. I do think that. And And I think, like I said, life be life, and
You should be
sometimes
working less and getting paid the same amount, if not more. And I
we're
want
not going to talk about money.
no, but you know but money it's the incentive, it's the motive a lot of the time, right? And like I would love to.
There's a lot of ways to make money. We know that with
For
2024,
sure.
and ever since the pandemic, there's a lot of ways to make money. I think medicine is, if you're passionate about helping people
Mhm.
and you love medicine and you love science, it could be a good way to make money. If you're really personable, it could be a good way to make money. It's kind of guaranteed in a
Mhm.
way, right?
Mhm.
But it shouldn't be your sole reason why you're going into medicine, because it
Oh,
is.
money?
Yeah,
Nah.
no,
Hell
money
nah.
can't be
Hell
the
nah.
reason
Hell
why
nah.
you're doing
If
this.
money is the reason why you're in this place, I don't want to see you. And the
Yeah.
only way I want to see you if you're my last resort.
Yeah.
I don't want to see you. I got another question for you, and the
Okay.
question is, I feel like every time I ask a question, I can hear your heart
It's
beating. Like, what this nigga
I'm
about to
nervous.
ask me? Right. In your opinion, what do you think the medical system has to do to regain the trust of Black people?
That's a big question.
It's a big
I
question.
think being transparent.
Transparent, honesty.
I think transparency is key. I think if there was more transparency within the
Mhm.
medical system,
Given all
medical
the
care
details.
system, given the details in terms of like really what's really going on in the hospital, especially when it pertains to Black people. Because, like I said, we understand why Black people are apprehensive with going to doctors, with going to the hospitals,
Right.
right? Because of years and years of misuse, right? We can
Mhm.
talk about Tuskegee. We can talk about Marion Sims. We
Right.
can talk about radiation treatments that have been done to Black people
Jesus.
unnecessarily and excessively.
Wow.
We can talk about lobectomies that have been done on Black patients.
What's that?
Lobectomies. So
Mhm.
I think in the 1960s, there was a psychiatrist who performed lobectomy specifically on Black
Cutting into
patients,
people's brains and shit?
cutting people's brains in half to see if obviously they had some type of psychiatric disorder in order to see if they benefited. And they know now that they're obviously way worse. So there's so many examples of why there is a mistrust of the medical community, right?
Even with, and listen, it's the only thing on vaccinations I'm gonna bring up.
Oh
and
my
I'm,
God.
and I'm not even really bringing it up like that. But it's the only
Don't
thing
get me
I'm
canceled.
No, I'm not. No, I'm not. Because I'm not even trying to do that. But like mistrust, right? Even when it comes down to COVID vaccinations and then I don't know if it's the government or the hospital telling the government or what, incentivizing people like, hey, yo, if you don't get this vaccination, how about now you're gonna lose your job? Which is like, hold on, my nigga. Like, out of all the ways that we gonna go about doing this, that can't be the way. And this adds to the mistrust, because to me, I'm so fortunate that I work at a Black-owned studio where it's 100% owned by Black people.
Yeah.
And there was zero pressure to do anything to my body. But my mom, my sister, my pops, you know what I mean? Which my dad works at a hospital. Like, they felt that pressure to get it. Like, we was holding off as a family. And then like our group chat started being like, yo, like they telling me we might not be. And my mom as a mother, she like, I can't not have money. I got 2 kids. My kid's grown, but you know, mom don't ever stop being mom. So mom thinking like, I can't be like my finances cannot be cut off because I always need to have just in case.
Yeah.
And it's like that kind of pressure to that I don't have all the answers, but there got to be a better way to get people healthy than telling them like, well, we're gonna pull the rug from under your feet and you might be homeless. Because your landlord like, hey, bro, like you 3 months behind. I get COVID was COVID, but I need that. You know what I mean? So yeah, the mistrust it runs deep, man. And we need to fire a lot of people, to be honest with you.
I agree.
We need to fire some people.
Are they going to get fired? I don't think so.
Man, say.
But transparency, I think being transparent about what's going on, why people are dying, having that evidence of what's going on in the hospital being published somewhere so people can see, I think would be helpful. And it would also make practitioners more responsible, right? Because I think there's a lot of cover up that happens in the hospital. And I think we're going to end here because I want my job. I got to keep the job. I got to keep my job, okay?
Is it risky? Have we?
What's risky?
Like, are we on
Talking
the edge? Like what we talked about?
I feel like the one thing that I would say about vaccines is that nothing is without risk. There is nothing without risk.
Well said.
And I think that
Well
if
said.
you're asking people to do things that has some risk, then there has to be a system in place in order to take care of those patients. That's what I would say.
That's love.
Yeah.
And that's what's missing from the hospitals. Like, I personally think anybody who's doing this job and you're not doing it with love in your heart, I don't want you around. And,
Yeah.
you know,
But they're going to be around.
yeah, they're going to be around. But that's why I think people need to, something else needs to be built. And I don't know how insane it is, but you know what though? I believe in God, and God told me anything is possible. You know what I mean? So with that being said, something needs to be built. And it's not on just it's not on my mind to figure that out. It's for the people that think like this and have it. They creatively understand.
But there are people who are doing that. There are people who are
I believe
working,
that,
right?
for
There are
sure.
people who are practicing natural medicine, alternative medicine, holistic medicine.
Right.
The one thing that I would say about that is just be careful,
But we
because
need a hospital,
that's
though.
still an industry. Holistic
Yeah.
medicine is still an industry, and people are making a lot of money. So just be careful.
Listen. Listen. Listen.
I think we're gonna need a part 2.
You think so?
I think
Where
so.
your person at?
She here. I
She
hear
here?
her. Uh-huh.
Okay, damn. Let me ask one more question.
Okay.
Okay, fuck all that. Okay, last question right here. Last question.
Mhm.
If you had the power to change one thing about the medical system, you had the complete autonomy, power, resources, you can change it. What would that be?
Make one thing to change about the medical system.
It don't even got to be one thing, but like if you had I'm talking about, you got the power, you got the resources, you got the authority to command people, to switch things around, to move things over, to remove this, to add that, to make the medical system better. Because you believe in the medical system, obviously, you know what I mean? Because it helps people.
I think there's not just one thing. There's so many things that need to be changed.
Give me a couple things.
Right? There's so again, there needs to be more diverse clinicians that are practicing. How does that happen? That happens early. That's by identifying children in high school that want to be doctors or nurses or physicians.
And encouraging them.
Not only encouraging them, but providing resources, because it's challenging.
It is.
A lot of communities, I think people have an issue with diversity, equity, inclusion because they feel as though some people may not have the mental ability to do this, right? They're not smart. And that's a fallacy, right? But if you provide people with the resources such as tutoring, right? Better classes, those same people that come from a lower socioeconomic community are going to be just as smart as anybody else.
And speak
right?
life
Because
into
the difference is just really about the education system, right? So this is
not
a big.
that the
this
other
is a
kids
huge,
are smarter than you.
No, it's a very loaded question. So one is education, finding early on who wants to be in the medical field, and really holding their hand throughout the process, providing with the resources that's gonna help them succeed. And there are programs that do that. I was a part of a program in college called Audacious that did that for me, provided me with free tutoring resources. Shout out to Dr. Khan.
Shout out to Dr. Khan.
What else? Foods, right? Light, putting that into healthcare system, having that in the hospitals.
Light?
Fresh light, real light, right? Allowing, better foods, more time. I think more time is needed. A lot of people don't even want to enter primary care anymore because they're not compensated for the amount of school that they're going to do, right? And like I said, medicine in its whole is a business. Going to medical school is expensive for a lot of people. There are some schools that are free now, but there are people who are going into significant debt and don't want to do primary care because they're thinking about how they're going to pay off their loans.
Right.
Again, the business aspect. Maybe if medical school was free for a lot of people, you would have better people practicing medicine. This is a big question.
That would be amazing. But I think you said everything that needed to be said. And with the last part you said, free. Or at least like realistic, you know? Listen, I know you got another show that you're about to do. First of all, I'm glad that you're back in the studio because you need to be here.
Thank you.
I've been here for 4 years. You're the first doctor. I might have met other doctors, but they didn't even leave an impression, so it doesn't even matter, right? They're far from memory. But like, you're the first doctor I've ever met that came in here and was like actively having conversations about what could be done to help. You know what I mean? What could be done to expand the minds of doctors and patients and help. And we don't really have that, to be honest. Like, I quoted Dr. Bobby Price earlier. I really like him because he's somebody who, like, you need somebody who has the respect of the title. You know what
he's
I
very
mean?
intelligent too.
You know what I
He-
mean?
You just don't need the title. You just need the information.
But
He
sometimes-
definitely has the
But
information.
some people, you need the respect of the title because some people, Dr. Sebi is not enough. Or people like him, right? It's not enough. Like, my dad's one of the smartest men I knew, but he like, I don't want to hear that shit. You know what I mean? Like,
what shit didn't
Dr.
you want to hear?
Sebi, I don't want to
really?
hear
Okay.
that shit. You know what I mean? I don't. You know what I mean? I want to talk to,
Oh,
I'd rather hear
okay.
Dr. Bobby Price. Is
Okay.
what my dad, you know, so what you're doing is really, really important.
Thank you.
Obviously, you do whatever you want to do with your life, but I want to let you know, as long as you're doing content, you specifically, you're making the world a better place. And I'm
Thank
not
you.
even trying to put extras on it, but it's just true. Familiar faces make us feel better.
I agree.
With that being said, thank you so much for
Thank you
being
for
here.
having me,
This was
Wolf.
great. This is not enough time. Not
We'll
enough
do a
time.
part two,
We're gonna
for
do a
sure.
part 2. I hope you guys enjoyed this. Do you want people following you on Instagram
They
or anything
can.
like that? Tell
It's
people where
my
they can
name.
find you.
Dr. Jennifer Charles and Money Power and Medicine is the podcast.
Money, Power, and
And
Medicine
Medicine,
is
yeah.
the podcast. There's episodes that are actively out right now. There's shorts.
Well, no, it's gonna be on Tuesday, the first episode.
You ain't
It's gonna
dropped new episodes?
Mm-mm.
The first episode is dropping this Tuesday.
Yeah.
So I'm gonna drop this soon then.
Okay.
So people can, you
The
know what I
18th,
mean?
so June 18th
Okay.
is when
I'm gonna
it's
drop
dropping.
this. This gonna be the next episode I
Okay.
dropped in. Thank you so much for your time, for
Thank
your
you for
wisdom,
having
for
me.
your intellect, for your patience. And you already know. I'm gonna get out of here. Please leave a rating and review. Before we leave though, I gotta give you the outro, the religion, the spirit of the brand. Whenever I'm working, I will remember that done is better than perfect. And if I'm satisfied with my work, then that means that I'm living in my purpose. We got a doctor on the show, y'all. We made it. We fucking made it. Out.
You're so funny. You gassed me up. Yes, you did.